Welcome to the Communication in Rett Syndrome webinar series, Course 2. I'm Andrea Etke, a speech-language pathologist and one of the moderators at the IRSF Communication Guidelines Hive, an online forum for professionals who complete all three of these courses. I'm excited to continue this series with you. If you're watching these webinars in order, then you have already watched webinar 1, in which we gave an overview of Rett syndrome and what communication may look like for a person with Rett. In this second installment of the webinar series, our focus is on the principles of assessment. We will be discussing how to conduct evidence-based assessments for communication in individuals with Rett syndrome. Second, we are going to look at strategies for adapting formalized assessments and for utilizing real-world contexts. This course is offered for 1 professional development hour, and at the conclusion of this course, you, the participant, will take a quiz, and upon successful completion, which is greater than 80% accuracy, you will receive a certificate. Let's get started. The goal for you as the learner in this webinar is that at the conclusion of this course, you will be able to describe the best practices for assessment of communication in Rett syndrome, define and provide an example of a dynamic assessment, and be able to explain how to adapt standardized assessments to meet the needs of individuals with Rett syndrome. If you don't already have a copy of the communication guidelines, you can order one at rettsyndrome.org. There are hard copies and downloadable copies, and these are just great to have on hand. One, because the information in it is so excellent and it is what we cover in this webinar series, and 2, they're great to share with any communication partners that you may be interacting with. So thinking of school personnel, a co-treating therapist maybe, family members, members who have a child who's newly been diagnosed with Rett syndrome, and the cost is just $10. Also, in this webinar, I will be referencing a few different assessments that are explained in more detail in the appendix of the guidelines, so if you want that information on those assessments, you can look there. In this session, we are going to be covering the information from sections 5, 6, and 7 of the communication guidelines. These sections describe the fundamentals of performing assessments, the specifics of doing an AAC assessment, and then strategies to determine the appropriateness of an AAC system or device. If you have a copy of the handbook, you can even follow along in these sections. All right, so let's get into section 5 on assessment. As with any type of assessment, there are some principles that you want to hold on to. So whether you are an educator or maybe a physical therapist that's watching this, I'm sure that you have fundamentals or principles that you hold on to when you are doing an assessment with an individual that you're working with. And when we think of assessing communication, speech-language pathologists working with individuals with Rett syndrome, or really any other complex disorder with complex communication needs, should hold on to these principles to ensure that you are achieving the most accurate assessment. We're going to look at each of these fundamentals in more detail on the following slides, but just as an overview, here is what we're thinking about. Number 1, assessments should be a team effort. 2, they should be holistic, and we'll talk about what that means. Number 3, assessments should consider the opportunities and the barriers to communication in various settings for the individual that they are assessing. Number 4, you should know that standardized assessments may not accurately reflect an individual with Rett syndrome's underlying ability, so we'll talk about how to adjust for that. And then number 5, consider doing a dynamic assessment. Assessment should be a team process. The outcome of an assessment should not just rely on the judgment of one professional in isolation. Rather, assessments of communication skills and needs should include the contributions of many communication partners. For example, you want to include the individual with Rett syndrome themselves, number one, parents, caregivers, teachers, other therapists, and possibly even peers. All members involved in the assessment should have an understanding of Rett syndrome in general and the needs of the individual in particular. And I like this quote here that was included in the communication guidelines in print. It says, interview family to learn how the individual communicates, what strategies have been tried, been successful, and not successful. I think that's really important to highlight the how it's crucial to involve family members who probably know the individual best and have maybe already gone through an assessment before and have some understanding of strategies that have worked or have not worked, and that can help you save time, and it can help maybe focus the assessment a little bit better. Number 2, assessments should be informed, comprehensive, and holistic. So a holistic approach means that the assessment provides a view of the individual as a whole person. So rather than looking at particular characteristics or challenges in isolation, to accomplish this, we might want to refer to the WHO's ICF model. So it's a model that allows a more comprehensive view of a person's health by considering not just their medical condition. So we're looking beyond just this person that I'm assessing has Rett syndrome. But how do they function in their daily life, and how do they interact with their environment? So first, let's look at the two main components. So we have functioning and disability. And this part of the model explains how well a person can perform activities and participate in life situations. That includes the body functions and structures, and this is how their body works and their physical structure. So we're looking at all the different comorbidities that go alongside Rett syndrome that we covered in the first webinar. And then this is a great place to involve the opinions and expertise of other professionals that are equipped to assess and talk about body structures and functions. And then when we look at activity and participation, this is what the person can do in their daily life and how they engage in society. And next we think about these environmental factors. These are external elements that can impact a person's functioning, and they include things like social attitudes, physical barriers, and even legal policies. Lastly, the model considers personal factors. These are individual characteristics such as age, gender, lifestyle, habits, all the things that influence how a person experiences health and disability. So the ICF model is used worldwide to provide a common language for health professionals, researchers, and policymakers, and it helps to describe and compare health and disability across different countries and cultures. So this is a model that you might want to refer to when you're undertaking an assessment of a person with Rett syndrome to help guide your assessment to be sure that you're taking all of these factors into consideration. Number 3, when doing an assessment, you want to consider the opportunities and barriers to communication in varied settings. You want to think about the broader context around the individual. So maybe asking, what is their social network? You might consider doing an actual social networks inventory, which is a form of assessment that is pictured on this slide. And within this assessment, you are asked to consider these 5 circles of communication partners that the individual that you are assessing interacts with. So you're looking at family and friends, acquaintances, paid workers, and then unfamiliar partners or people in the wider community. Looking at these circles can help identify the individual's barriers and opportunities to communication. A barrier might be limited knowledge or skills or training needs of communication partners that are within one of those circles. An opportunity might be revealed when you look at the student's school schedule. What are some opportunities that student has to interact with and communicate with their peers? And then it also, using a form of assessment like this, helps you to look at different settings. You're considering where the individual goes to school and the home that they live in and the community that they exist in. So using a tool like social networks can help you to gather information on the different settings and communication partners that the individual lives with and interacts with. Number 4, modified assessments. So be aware that standardized assessments may not accurately reflect an individual's underlying ability, because formal standardized assessments are not normed to include individuals with Rett syndrome, but they're also not typically accessible to individuals with Rett syndrome. So accessible means that most of the time the standardized assessments require a verbal response or a nonverbal response that you point to the answer, or the person taking the test is pointing to their response. So that's, if you do choose to give a standardized assessment, consider how you might adapt the test so that it could be accessible. For instance, if you're going to give the PPVT, the Peabody Picture Vocabulary Test, that requires a response of pointing to a response in a field of 4. So could you adapt that assessment to allow the individual to use their eyes to point to that field of 4? Or we're going to look at an example of using eye tracking for the PPVT. But thinking about how to make the assessment accessible to accommodate the communication abilities that the person has. And there are many more suggestions on modifying assessments in Appendix 3 of the Communication Guidelines, and then we'll look at 2 examples in a bit. Here they are. Here's 2 research examples of direct application of modified assessments with individuals with Rett syndrome. The first is an article by Sandra Gruther, and she reports how she used the communication matrix to describe the communication abilities of some clients with Rett syndrome that were coming into her clinic. And the communication matrix is a great tool that you might want to consider using. It charts the individual's communication acts across 4 different domains and with different increasing levels of complexity of language. And it's incredibly sensitive to small changes across the domains and across the levels of complexity of communication, which makes it a really great tool for assessment, but then for ongoing assessment, so that you can chart and keep a record of new ways that the individual that you're assessing is either showing new or emerging skills in communication, or maybe mastering other skills too. Another article to check out is pictured here on the right, and entitled Assessing Cognitive Functioning in Females with Rett Syndrome by Eye Tracking. And I bring this article to your attention because this is an example of how these researchers did adapt the Peabody Picture Vocabulary Test so that participants could respond using their eyes. And it wasn't just paper-based with eye pointing, which you could definitely do, but this was using eye tracking technology to actually track where the individual was looking during the assessment. But it's a great example of how you could modify something that we use pretty often clinically as the assessment for this group of people. The 5th fundamental of performing assessments with people who have Rett syndrome is keeping the assessment dynamic. Dynamic assessments are a method that assesses a particular skill, and then that is followed by a phase of teaching that skill, and then reassessing the skill. So the purpose of this strategy is to identify different strategies that promote development rather than just comparing the results of one individual to another. So instead of just assessing and saying for a specific skill and saying this person cannot do it, instead you look for that skill, then you teach that skill, and then you retest for that skill to see if the way that you taught the skill had a positive or maybe negative effect on that person being able to learn and produce that skill. So like I said, step 1, teach the individual. You want to provide opportunities and then wait for that individual to demonstrate or not demonstrate the skill. And then 2, the step is to intervene. So maybe use some modeling and providing more opportunities and wait time for the individual to do so. Wait time is particularly important with individuals with Rett syndrome who may have challenges regulating their body and may have challenges with apraxia, right, motor movements that requires more time to align the body in a way that they're able to perform whatever motor movement that it is that they're intending to do so. And then the 3rd step is to retest. Again, waiting and providing opportunities to model again maybe. A worked example of this dynamic assessment is on page 37 and 38 of the communication guidelines, so maybe you want to check that out for a real-life example. So in general, a communication assessment of individuals with Rett should be informed by many voices, comprehensive, and considering various settings and holistic, looking at all the contexts of the individual. Be sure to focus on the skills and the needs of the individual with Rett syndrome and the skills and needs of their communication partners. Your assessments should be ongoing and dynamic. Okay, pay attention to this videoed interaction of a therapist and her client with Rett syndrome. They are engaged in a choice-making activity, which could be a useful form of assessment. As you watch, I'd ask you to look at the child's nonverbal skills, try to understand her interest in the activity, and then the ways in which she communicates yes and no. And then look for how the therapist responds and interprets the child's communicative behaviors.
Do you think we should put, excuse me, do you think we should put, I'm talking to you. Do you think we should put a beautiful bow in your hair? Yeah, thank you for looking. Yeah, thank you for looking at me and telling me yes. I love it when you do that. I'm wondering what colour we should put in. I've got a blue bow. I've got a pink bow. I've got a red bow. Do you want to see my red bow? I'm wondering what bow Sophia would like to wear. Would you like the blue bow? Yes, so maybe the blue bow. Would you like the pink bow?
You might like the pink bow too.
You might like the pink bow too. Oh, thank you for telling me.
Would you like the red bow?
Would you like the red bow? Oh my goodness, Sophia, we can only choose one bow for our hair. So you have to think, do you want the blue bow? The pink bow?
The red bow?
Or the red bow?
The blue bow?
Do you want the blue bow?
No, looking away.
No, looking away. No to the blue bow.
Do you want the pink bow?
Do you want the pink bow? Would you like the pink bow?
Yes, looking at Auntie
Yes, looking at Auntie Callie. You're thinking maybe the pink bow. Would you like the red bow? I can see you're looking at the red bow, but you need to look at me if you're telling me yes. Would you like the red bow?
No, looking away, not the red
No, looking away, not the red bow. So does Sophia want to wear the beautiful pink bow?
Yes, you do.
Yes, you do.
Thank
Thank you for looking at me and telling You're so smart. I'll put the beautiful pink bow in your hair. Yeah? Good girl. Oh, wow. You look like a princess with that pink bow in your hair. You look like a...
She's adorable. Okay, so if I was using this interaction as part of my assessment, I might include that the child often looks at her. I think she says, and Callie, so maybe she's not a therapist, I'm not sure. But she often looks at Callie in the eyes to say yes, and then she looked all the way up or looked away for no. So I might write that down. And it also appears that maybe this is in Sophie's home, and so maybe it's taking place in a naturalistic environment. So I'd say 2 thumbs up for that. And it seemed like maybe her family was present too. So there's familiar people involved in the assessment who are able to provide feedback and insight into her preferences, right? Somebody said that she really loves bows in her hair and that might be a great activity to do to understand her choice-making skills and abilities. And they videotaped it. So videotaping assessments could be a great way to share this information with others who are looking for understanding the results of the assessment or who were not present. So this was a great example of...
Do you think we should put...
Okay, so now you know the fundamentals of assessing a person with Rett syndrome regarding their language and communication skills. So let's talk about maybe some procedures you might consider using when completing the assessment. First, you want to conduct interviews with the individual's communication partners. You might even consider using a questionnaire to gather detailed information about the individual. You're going to want to make observations, maybe in different settings, to get a holistic view of the individual. I know this is something that I've done in my clinical work, is get to observe the individual at school and at home and in the community, because those different settings really have different, like we said, opportunities and barriers to communication. And the individual with Rett syndrome may use different modes of communication depending on the setting that they're in. And that's really useful information when doing an assessment. Like we talked about with Sophia, maybe videotape the individual so that you could share your observations and findings with others. And you want to use a combination of informal and maybe modified formal assessments that are dynamic. For more assessment ideas, there are 18 different ones listed in the Appendix 3 of the Communication Guidelines. It's not an exhaustive list, rather these are just some suggestions that came from the development process of the guidelines. Here is the communication matrix that I mentioned previously. If you want to check it out, I highly recommend it. And then there's the PPVT that we discussed could be made accessible or has been made accessible for eye pointing as a response mode. Okay, before we move on to section 6, I just want to mention one additional principle. The individual that you're assessing likely uses a broad range of communication modes. So you want to be sure to address all of them in your assessment. So you want to look at their nonverbal skills. How are they using eye gaze or joint attention to communicate? You want to think about their level of cognitive awareness. During your assessment, what did you see as far as their ability to demonstrate cause and effect, their vocabulary use, their reasoning levels? Be sure to talk about how they currently communicate. If you are assessing for considering an AAC system in the future, how are they currently communicating without something like that? Look at the range of communicative functions. Is the individual making comments, asking questions, responding to yes, no, using complex sentences, using language? What are those different functions, the whole range that the individual is using or not using currently? In your assessment, be sure to talk about the strategies and the systems that have been tried in the past. Remember how you are going to be interviewing family members or caregivers or previous therapists, people that are familiar with the person. What has been done? What has worked? What has not worked? What are some activities or topics that they're interested in and motivated by? These can be really important in doing an assessment to get that level of engagement with the individual so that there's something that they want to communicate about. And then something else to consider, what's their oral motor skills like? Not all individuals with Rett syndrome are nonverbal. There are some that still have that retained skill of spoken language, and so you want to report on that. Are there some words that the individual says? Are they approximations? Is that something that they're working on? So just being considerate of that, that spoken language might be part of the range of their communication abilities during your assessment. Section 6 of the communication guidelines is about AAC assessment as a starting point, and of course, I love this quote on the front in the handbook, and it says, "No prerequisite skills must be demonstrated." There are no skills that a person of any age must demonstrate prior to you considering AAC for them as a way to communicate. There is no person with Rett syndrome that is too old or too young or too cognitively impaired, whatever that means, or too anything to deserve the opportunity to communicate with the world around them. An aided AAC can be an option even before that person has demonstrated the understanding of cause and effect, clear choice making, or communicative intent. It is possible that you already have experience in performing an AAC assessment. Maybe you've just never completed one with a person with Rett syndrome before, or are unfamiliar with how to assess eye gaze. So what I want you to know is that eye gaze is usually the best access method for people with Rett syndrome, but others can still use their hands for direct selection too. And still others use switches to control the device. So just keeping that in mind as you move forward with an AAC assessment. You also want to consider a range of symbol systems. There is no one right system for all people with Rett syndrome. The symbol system that's best for a person with Rett syndrome is the one that has been found best for that person. That's really how it is. It's not a one-size-fits-all solution. Consider the layout that you believe the individual would best benefit from. So you're thinking about the size and the number of symbols on the screen. Maybe the layout has high contrast symbols because the individual's been determined to have a cortical visual impairment. Just taking all of those aspects of complexity in the screen or on the display and into consideration during your assessment. Trial periods are essential. They're required by almost all insurance companies, I'd say, but they're important to allow sufficient time for the person and their communication partners to try out the system and get a feel for it. And we're going to talk more about AAC trial periods in a second. And then lastly, I just want to draw your attention to page 43 of the guidelines. On that page, there's a list of different models of best practice when completing AAC assessments. These are the 6-step process, the participation model, and the model of communicative competence. And so if you want to know more about each of those, please check those out in the handbook. All right, let's look at our second video of this webinar. As you're watching this video, consider what information you could glean from it if the girl was your client and you were doing an AAC assessment of her current system. And then maybe think about what strategies are being used to enable her to demonstrate these skills.
That's so silly.
You think it's really silly to be painting eggs?
That's great.
You think it's great?
That's great.
I think perhaps you'd like it if you let yourself.
Cute. What's cute?
No, maybe Esme.
That's so silly.
What do you think of Patrick's egg? He's painting.
I think absolutely.
You think absolutely. I think
Cute.
You think it's cute, really?
Absolutely.
I think you're going through
Back.
lots of different things.
I want to talk with you.
Yeah, go for it.
Tell
me, why are you cross?
Mommy, why did you get to talk?
That's so silly.
I know it's silly,
That's
but humour me.
That's great.
This is fun.
Cute. More words.
Don't you throw that egg.
Okay, so if I were the evaluating therapist here, I would have noted that Esme uses eye gaze to access her device. I'm not sure if you could see, but I'm familiar with this layout, and so I know that it's fairly complex, and there is a variety of vocabulary available to her. There are one-word symbols, there are pre-stored phrases on the buttons. There's vocabulary with different communicative functions like commenting, protesting, asking questions. We saw her do some of that. And then also I would note that this is occurring in a naturalistic setting, right? She's probably at home. She's doing what might be a preferred activity or a non-preferred activity. I'm not even sure that she is sure how she feels about it. I think she's not so happy, but maybe said this could be kind of fun or cute. And her mom and her brother, it seems, are present with her. So there's familiar communication partners too. Even her brother chimed in and said what he thought using her device. So you can learn a lot from this simple interaction about the different ways in which Esme is using AAC to communicate. So keep something like this in mind when you're getting ready to structure an assessment, or if you have a family that you're working with that has an AAC device and they're trialing it, maybe ask them for something like this, ask them to record some interactions of ways that they're using the device at home and ways to give you more insight, even if you're not there at the time that they're using it. Okay, so thinking about how to assess for readiness for eye gaze. So the overall health, visual skills, attention, memory, motivation, prior experience with AAC, all of those factors are going to impact a person's ability to use eye gaze technology. So a careful and comprehensive assessment of all of those factors can help to determine whether an individual is a strong candidate for eye gaze, if they would benefit from additional investigation, a trial of a different access method, or maybe even a combination of both eye gaze and another access method is needed. Assessing readiness for eye gaze is best conducted through informal activities like the one that we saw in the previous video with Esme. Also, using photos of familiar people on the screen can be motivating. There's also built-in software tools that can track and record the person's eye movements and gaze patterns on the screen, which could be helpful information to get a feel for where they're looking and how often. An individual, though, does not need to pass an assessment at an early level of screen use before their response to more advanced levels of eye gaze technology can be assessed. So this I see sometimes with different devices that come with sort of beginning use, like cause and effect eye tracking games. And sometimes it's perceived that if the individual doesn't engage in these really simple cause and effect activities with eye gaze, then they're just not candidates for eye gaze technology at all. And that's just really not true. It's not that they have to pass it. Those things can just be a tool as an indicator of maybe things that work, things that don't work, distance, things that they like or dislike, or just ideas of ways to adapt. So it's not that they have to pass a certain level before they go on to the next more complicated level. And similarly, it is not necessary for the person that you're assessing to achieve a successful calibration on the eye gaze device to continue assessing them for this type of access method. I have worked with many women and girls with Rett syndrome that are not able to do their own calibration just because it requires a specific eye tracking movement from across the screen, from left to right, across and up and down. And like we've said, with apraxia, that can be really hard. And then I have worked with other clients that are able to do their own calibration, and one in particular that I'm thinking of, she goes to her track status on her device on her own and checks her own calibration. So even if that person's not able to do calibration on their own that you're assessing, that doesn't mean that they're not a candidate. I've even used my own calibration to just get them going, or maybe the person's parents. That can just work well enough. So continued eye gaze use also over time can help the individual to be able to successfully achieve a good calibration. So thinking about that too. Maybe at the beginning of using the device, the eye tracking device, they're not able to do calibration, but then over an extended period of time, that's a skill that they develop. Okay, lastly, we're going to look at Section 7 in Course 2. And Section 7 involves how to assess an existing system or device or trialing a new device. So Section 6 just kind of sets us up for things that you might want to look for when you're determining if a person might be a great candidate for AAC, which, as I said, almost everybody is. But Section 7 really goes into more of the fine details of you're doing an assessment on a device to see if it's appropriate, and here are some things to look for. Okay, first let's discuss why trial periods are essential for both high-tech and low-tech systems or devices. So these trial periods allow us to evaluate how well a particular system or device meets the needs of the individual. By testing these technologies in real-life situations, we can gather valuable feedback and make informed decisions about their suitability. Eye gaze technology can be a powerful tool for individuals with Rett syndrome, right? It can give them the ability to communicate and interact with their environment using their eyes, but it's really important that we conduct this trial period to make sure that it's the right fit for each person. We can, and even during this trial period, we're not just assessing like yes or no, this person is a candidate, or no, they're not. We're using that time to make necessary adjustments and optimize its use. So successful trials of an AAC device will have 1, support from professionals. This means having experts who can guide and assist the family and the person throughout the trial. This would include the device reps. This would include an assistive technology person. This would include yourself if you're a communication professional. It's a wraparound support of team members who are supporting the person so that they have the best, most successful opportunity to trial a device as possible. A successful trial will span different environments and with different communication partners to assess how well the device works in different settings and with different people. And this can be really important, especially when I think about children and being in a school setting or being on the playground or in a cafeteria setting maybe. Some devices just don't have an external speaker that are loud enough to be heard over all of the other environmental noise, and that's something that I would probably want to take into consideration during the trial. Or portability, right? Say this person is an on-the-go person. If they have a device that's 12 pounds and very large and hard to move, during the trial you're going to find out that that's just really not going to be suitable for them. A trial should last at least 8 weeks, which is what's covered in the guidelines, but obviously there are insurance company and like especially Medicaid regulations that might be a little bit different than that, but just allowing a duration that gives enough time to thoroughly test the technology and then make those adjustments and keep testing. And then lastly, you want to consider all the device-specific features, and there are many. So let's go to the next slide. So many of these aspects are brought together in feature matching, which might be something that you're already aware of. Feature matching is a model of best practice in AAC that aims to match the person's needs and abilities with the AAC system. So that's a kind of broad view, a broad way to approach that. But there's so many different factors that you want to think about. We talked about portability, but what about mounting? Is the person in a Riften chair, a wheelchair, a stroller chair, needs more support, walks around, right? So we have some individuals with Rett syndrome who are ambulatory and who walk but use eye gaze. And so that is an interesting feature to consider too during the trial. Where will the device sit? Where will it live? Where will it stay? How will it move with that person if they're unable to walk with it themselves? Think about size, weight, battery life, how to use it in different environments, like going outside. The sunshine can make eye gaze and high-tech screens, I guess I should say, sometimes difficult to access in the sun. Thinking about all the different types of software that are available, like language programs and symbol sets. Maybe the individual's already familiar. Maybe they already use Grid or LAMP, so if you're looking at a new device and you're looking for specific features, consider the fact that they're already familiar with that language system. The level of technical knowledge of the communication partners can definitely be a device-specific feature to consider. So how comfortable are the people around that person with supporting them in that way to use the technology? And then what's the long-term technical support offered by the supplier? Is there any? What do you do if the device breaks down or has problems and needs assistance? All of those things are really important to think about. Obviously, the cost to purchase, whether or not it's covered by insurance, what the funding process looks like. Those are all really crucial to consider. Okay, for our last video, we're going to see how Lisa successfully uses her AAC device. And as you're watching it, think about, again, how you would use information from this video to help inform an AAC assessment.
Hey Lisa, hi.
Hey Lisa, hi.
Hey, hi.
Hey, hi.
Are you looking at your iPad?
Are you looking at your iPad?
Oh.
Oh. Lisa,
Do you want to watch a movie?
do you want to watch a movie?
You do.
You do.
What movie do you want?
What movie do you want?
I know you're excited.
I know you're excited.
Are you going to pick a movie?
Are you going to pick a movie?
You are. Okay. You know what?
You
Why
are.
don't you use your
Okay.
hand?
You know what? Why don't you use your hand?
There you
Use
go.
your hand.
Pick a movie.
There you go. Pick a movie. Ah.
There you go. You did it. Good job.
There you
Lise.
go. You did it. Good job, Lise.
I love this video. I love the interaction between Lisa and her mom and how Lisa gives like this little chuckle to indicate that she's saying yes, but she's also very excited, and her mom responds to it. And so in this example, we've seen that Lisa uses an iPad and she uses direct selection with her hand to access it, and she's selecting a movie to watch, which in and of itself, that action isn't necessarily communicative in purpose, but she's using this iPad that probably has a dual purpose, probably has a language system built on it, maybe like Proloquo, and it's a great demonstration of this is how she uses this device to make a selection, to indicate a want, a preferred activity, and she's interacting back and forth with her mom, which I just think is lovely. So that's how I would interpret this video if I was using it as part of the assessment. I think about too, maybe considering I would ask her mom more about the feature matching, like what factors were important to them when selecting the iPad, what kind of consideration went into that, what does their life look like, where are places that Lisa goes, did it have to be small and very portable, was her mom already familiar with using an iOS system, did that have anything to do with it? So there's a lot that can be gleaned from interactions like this. Okay, in conclusion, we have gotten to the end of course number 2. We have looked at sections 5, 6, and 7 of the communication guidelines, and we've talked about different evidence-based strategies to assist clinicians in assessing the abilities of individuals with Rett syndrome so that their skills are evident, their interests and motivations can be considered, and so that the clinician can build an effective intervention plan to advance communication and improve quality of life. So that's a little bit of foreshadowing of where we're going to go with course number 3, which is on intervention. But I hope you enjoyed course number 2, which was on assessment and AAC assessment. All right, so you can go ahead to this link, rettsyndrome.org /for communication professionals for the link to quiz 2. And additional program information. If you want to grab your copy of the communication guidelines, that's there as well. So take the quiz, and after successful completion, you will be, of all 3, you will be invited to join our peer moderated online forum, which I did call the Hive when we started this, and we would welcome you there. So take the quiz and then go on to watch course number 3. And we will see you hopefully in the Hive. Thank you.